you know, the older generation, so the generation before, like the baby boomers, what do they call it? The golden generation or something?
Yeah.
Whatever. Um, that generation, yeah, I mean, there's more hesitation with them than there is like with the younger kind of generation. And I mean, there is some initial hesitation at first too, but I find that even if it's females or males, like if you're nursing with somebody, there's always initially going to be that kind of like hesitation in it, like at the first meeting. So as long as you kind of get rapport with a client before you go in and start doing care. Like obviously, I'm not going to go in and just be like, "Oh, hey, how's it going? My name's Dan. Let's get your pants off or whatever."
Yeah.
Right? It's not exactly
Yeah.
a good thing to do. But I mean,
Right.
a female nurse wouldn't do the same either,
No.
right? You gotta get your rapport up, and I find that 99% of the time, they're quite comfortable after that point. But I mean, there's always that 1%, and I mean, that's fine. I mean, it's always when you're working, it's also as a team, right? So if there is that hesitation, then I go, that's fine. I mean, you're not going to want to put yourself into a bad situation, right? So you would go and get somebody else to do the care, and then you would go and help them with something else as well too, right? Being a male nurse is a it's an odd kind of profession in the fact that I feel like there has been some discrimination, but I've never felt like a negative kind of discrimination. It's always been like a positive discrimination in a way where it's like, I don't know if that is good or not, but I mean, it's just like, it seems like, not that they expect more from you or anything like that, but it's like, there's a lot of times where it's like you're immediately in the good books without proving yourself. And I mean, I do my best to prove myself in the work and to get everyone's respect and stuff like that, but a lot of times it's just like, I don't know if it's just that you're different in people's heads or something like that or what, but I find a lot of times that it's like immediately like, oh good, he's a guy. I'll tell you, it's definitely in the opposite direction where it's like every single job that I've ever applied for, I've always gotten a call back for, and I've always usually, I don't think any of the jobs that I ever interviewed for I didn't get. So, I mean, it's like a positive discrimination in that regard. Yeah, I would say that. Like when I was working on medicine, yeah, there was a lot of times when they would come and get me. It's just like, oh, this person's heavy or whatever. I mean, that's fine. I didn't mind at all, really. It was frustrating sometimes when you had like a really heavy patient, and then you'd have people like coming to you for assistance as well too. But I mean, it's not. I didn't mind it. You do what you got to do because it's all working as a team, right?
Yeah, that's right.
So, I mean, now I work on mental health, and so.
That's an interesting field too.
It definitely is. I mean, but again, it's the same sort of thing where it's like they like to have the males on the unit because a lot of times the patients are a little bit more receptive to us saying the rules or whatever, and also they like to have like the physical presence there in case there is some sort of confrontational kind of situation, right? So. I think it's just the same as like being any female nurse. I mean, you put the patients first, you get the job done, you work well as a team, and advocate for the patients whenever you can. And like, yeah, the golden generation for sure too. It's like or you my doctor or whatever, and then like there's like, well, you're a nurse, and it just it throws them off, right? But I find that there's like a little bit more in the terms of pushing people to get you to be a doctor, right? Like I don't know if like females ever get confronted with that, but like I used to get that quite a bit too, where it'd be like, it's like, oh, you're a male nurse. Well, why didn't you want to be a doctor? that's usually like a lot of times that second question comes out, right? And it's like, well, 16 years of university, 2 years college.
Exactly.
I mean, if you get the job done and positive patient outcome, they enjoyed having you care for them, and you feel like you've done good work. You know, just positive health outcomes for the patient is always the main thing that you look for. Um, yeah, I just be comfortable with working with women and be flexible because there's a lot of times when you're in different situations, and I know that you guys are PSWs, so you guys kind of know the business, but when you get into a hospital setting, it's like there's a whole lot of different situations you get yourself into, but and be flexible and don't take things personally if there is ever anybody that does refuse care from you. It's just the way it is, right?